Thomsonian System of Practice, A Guide to Health and the Science of Medicine. Introduction to the Thomsonian System. The Thomsonian System of Medicine, pioneered by Samuel Thomson in the late 18th and early 19th centuries, represents a significant pivot in the approach to healthcare during a period dominated by complex and often hazardous medical practices. Born in 1769 in Alstead, New Hampshire, Thomson, who was largely self-taught, developed a medical philosophy rooted in simplicity, natural remedies, and the innate healing power of the human body. His system was not just a critique but an alternative to the prevailing medical orthodoxy, which he viewed as both ineffective and dangerous. What is the Thomsonian system? Thomson's approach to medicine was based on a set of foundational principles. Heat as a healing force. Thomson believed that diseases were essentially states of imbalance that could be remedied by promoting circulation and vitality through heat. He used steam baths and hot herbal teas to induce sweating, which he saw as a method to expel toxins and restore health. Steam therapy. Patients would sit in a steam box or cover themselves with blankets to sweat out impurities. Hot teas. Herbal infusions like those made from cayenne pepper were used to increase internal heat. Herbal remedies. At the heart of Thomson's practice were herbs. He argued that these natural substances were the true medicine, far safer than the mineral-based drugs like mercury or opium. Lobelia inflata, Indian tobacco. Used as an emetic to induce vomiting, which Thomson believed purged the body of harmful substances. Capsicum annuum, cayenne pepper. Stimulated circulation and was thought to be a general tonic. Other herbs included golden seal, bayberry, and myrrh, each with specific roles in treating different ailments. Avoidance of mineral drugs. Thomson was vehemently against the use of mineral poisons, which he believed more often harmed than healed. Cleansing the system. He promoted the idea of cleansing through natural means, viewing this as a way to restore the body's natural state. Vomiting and sweating. These were seen as methods to cleanse the body of internal impurities. Empowerment of the individual. Thomson's system aimed to democratize healthcare by teaching individuals to treat themselves and their families, reducing the need for doctors. Educational efforts. He published books like New Guide to Health to spread his knowledge. Simplicity and accessibility. His treatments were designed to be simple, understandable, and applicable by anyone without specialized training. Principles and practices in detail. Observation over theory. Thomson's method was empirical. He tested his treatments on himself and others, documenting outcomes to refine his practices. He distrusted the theoretical constructs of medical education, which he saw as disconnected from practical healing. Holistic view of health. He viewed the body as a holistic system where health was the natural state, and disease was a deviation that could be corrected by rebalancing the body's energies. Empirical evidence. His approach was grounded in trial and error, leading to a system where effectiveness was measured by observable results rather than by adherence to any medical dogma. Results and impact. Public health movement. The Thomsonian system gained a massive following, leading to the formation of the Thomsonian Medical Society in 1828, where practitioners could gather, learn, and spread his methods. Legal and social impact. Thomson's efforts to patent his system and challenge conventional medical licensing laws sparked debates over medical freedom and led to numerous legal battles. His insistence on public education in medicine was revolutionary. Controversy. While many hailed Thomson's methods for their simplicity and apparent effectiveness, the medical establishment criticized them as quackery, leading to a polarized view of his contributions. A deeper look at historical medical theories. To fully grasp the revolutionary nature of Thomson's work, it's crucial to understand the medical philosophies he was reacting against. Hippocrates, for 60 BC known as the father of medicine, Hippocrates advocated for the body's natural healing powers. His use of simple, often plant-based treatments resonated with Thomson's philosophy. Theory of humours. Hippocrates believed in balancing the bodies for humours, somewhat akin to Thomson's idea of restoring balance through natural means. Galen, AD 131. His practice, which mixed herbs into complex concoctions, was successful in his time but later criticized for its complexity and reliance on humoral theory. Paracelsus, 1493. A figure Thomson opposed due to his introduction of aggressive chemical treatments. Paracelsus's use of mercury and other minerals marked a shift towards more invasive treatments. Boerhaave, 1668–1738. Known for his pragmatic approach, Boerhaave criticized the over-reliance on theory, aligning somewhat with Thomson's empirical methods. He famously advised against the consultation of physicians, favoring simple remedies. Modern critics, scholars like Dr. Jacob Bigelow lamented the speculative nature of medicine, with Dr. Benjamin Rush notably critiquing the profession's reliance on practices like bloodletting, which he eventually came to regret. The Thomsonian system of practice was more than just a set of medical treatments, it was a philosophy that challenged the medical norms of its time. By emphasizing natural remedies, patient empowerment, and a return to simplicity, Thomson laid the groundwork for future movements in holistic and alternative medicine. While many of his specific treatments have been refined or replaced, the core principles of his system, simplicity, natural healing, and skepticism of established practices continue to influence contemporary discussions on health and medicine. His legacy is a reminder of the ongoing need to critically evaluate medical practices and to consider the health benefits of nature's offerings.